Good afternoon, ladies and gentlemen. I want to introduce my 3D model of heart rate regulation that I have developed within the last 20 years to improve my therapy of autonomic dysfunction in childhood. For this research, we analyzed the heart rate and heart rate variability generated in the sinus node that represents the regulation of the autonomic nervous system. There are many methods to investigate heart rate and heart rate variability, beginning with pulse diagnostic used by Chinese doctors 5,000 years ago. We now use the Holter ECG to analyze heart rate and heart rate variability. In some patients, we use smartwatches, and in the intensive care monitoring, we used high technology monitors. For the standing test, we use a device from Biozyme. For our research, we use time domain and frequency analyzers. However, we try to return to the simple heart rate measurement in the 24-hour Holter ECG and the active standing test, while mostly represents the success of a therapeutic intervention. This slide shows the changes of heart rate variability in the human life cycle. The heart rates decrease within the first 10 years and then remain relatively similar on average. However, there's a steep increase of global heart variability that you can recognize in the total power of the frequency domain analyzers and the SDNN value. The vagus activity is represented by the RMSSD value and the high frequency power of fast Fourier analyzers. There is an increase until puberty and a further decline until death. There are important individual differences in vagus activity, represented by the parameter RMSSD in this slide. Again, we can recognize the steep increase of vagus activity by autonomic imprinting within the first 1,000 days of life. There's a further steep increase during puberty and a steep decrease between 40 and 15 years of life, and a further slow decrease of heart rate variability until the death. We can find patients with obesity in this red-colored group with low RMSSD values, as well as those children with attention deficit disorder or short stature. Some infants are born with heart defect or premature born who have very low vagus activity at the beginning of the life. Others, like athletes or Anorexia Nervosa patients, have higher vagus activities than normal. And all this have an impact on prognosis by cardiovascular disease. Our current view of heart rate regulation is dominated by the bipolar view of the autonomic system with a heart rate lowering effect of the parasympathicus and a heart rate increase by sympathicus activation. This simplified picture of heart rate regulation ignores the most dominant effect of body weight and body surface area on heart rate in the biology that depends on metabolic rate and thermoregulation. In this sheet, you see the mouse with very high heart rate at the one end of the line and the horse as a big animal on the other hand. The normal weight children are lying on this line, but those who are obese have higher heart rates, and those who are anorectic have lower heart rates. And that is the most dominant effect on heart rate recognizable on the mean heart rate. Again, you can see this dominant rule of the animal size on the biology of heart rate regulation that depends on body weight, metabolic rate, and temperature. On the other hand, there are big change of our shape within the human biology. Again, these two pictures show our current view of heart rate regulation by the autonomic system under the control of the cortex, the hypothalamus, and the nervus tractus solitarius, who control the heart rate via sympathetic nerves and the beta 1 and beta 2 receptors, and the parasympathetic nerves via the M2 receptor. On the cellular level, heart rate regulation seems to be more sophisticated and not only dominated by the sympathicus and parasympathicus, but also by ion currents like the funny channel, who probably are regulated by caloric intake, evaporating, sports, omega-3 fatty acids. With respect to this sophisticated view on heart rate regulation, we have to develop our two-dimensional view on heart rate regulation by a further dimension. The first two dimensions is the sympathicus and parasympathicus that dominates the current heart rate, but there are the mean heart rate, 24-hour heart rate, dominated by the metabolic rate, and perhaps there's a further impact of myocardial performance on heart rate variability. With respect to this model, we have further targets to control heart rate. There are indeed the beta and muscarinic receptor, but also the funny channel and probably the possibility to regulate heart rate with omega-3 fatty acids. In this three-dimensional view of heart rate regulation, there are clear, highly significant difference between the healthy child and the obese child who have higher heart rate and lower heart rate variability, and children with anorexia nervosa who have lower heart rates and higher heart rate variabilities. This measure data clearly show the increase of heart rate in children with obesity with respect to their metabolic control. Those with the metabolic syndrome have the highest heart rates and the lowest heart rate variability. On the other side, there are the anorexic children with low heart rates and very low heart rate variability who significantly increase the heart rate and decrease the heart rate variability during refeeding. The slide clearly shows with measured data the impact of caloric intake on heart rate and heart rate variability in children that depends on nutrition. These data clearly show the impact of omega-3 fatty acid supplementations in obese children with metabolic syndrome. There's a highly significant decrease in heart rate and increase of heart rate variability using omega-3 fatty acid supplementation in obese children. This slide shows the impact of nutrition on heart rate and heart rate variability in a girl with severe anorexia nervosa who received 30 heart rate disease with a long process of therapy within 4 years. There's an increase and decrease of heart rate during refeeding and starvation, but the maximal heart rates are undisturbed if the girl performs sport for 1 hour every day. There is a clear impact that the autonomic nervous system is not disturbed in this girl, but the mean heart rate depends on the calorie intake. This slide demonstrates the therapeutic process of this girl within 1,300 days. There's a reproducible effect of refeeding on mean heart rate and a nearly unaffected maximal heart rate and minimal heart rate in this girl. She recovered with a weight gain of 55.5 kilogram at the end of the therapeutic process. This study, published in PLOS ONE, show the impact of omega-3 fatty acids on inappropriate sinus tachycardia in children. There's a clear reduction of the circadian heart rate that is elevated in children with inappropriate sinus tachycardia, and a significant decrease of heart rate was demonstrated after omega-3 fatty acid supplementation. The patients with inappropriate sinus tachycardia in our cohort are those with short stages, with attention deficit disorder, with obesity, and some with hypertension. Those children with congenital heart defect, constitutional thinned, and anorexia nervosa have low heart rates. We published three studies of three-month omega-3 fatty acid supplementation with the same results on heart rate and heart rate variability. The omega-3 fatty acids are used in children with premature ventricular contraction, those with attention deficit disorder, those with obesity, and those with short stature. And this publication in the International Journal of Cardiology clearly show that the heart rate is reduced at day and night, and the heart rate variability increase after this nutritional supplementation. The arrhythmia in these patient groups decrease during this therapy. We further look what predict the impact of omega-3 fatty acid supplementation on heart rate decrease. We realize that there is an impact of bioavailability if those supplements who have no tocopherol didn't decrease heart rate, but the other who are from the discounters clearly show a decrease of heart rate that depends on the baseline heart rate. Our analyses clearly show that the baseline heart rate has the most important impact on heart rate reduction, with a decrease by 4 beats per minute in those with low heart rates below 90 beats per minute, and a decrease of 11 beats per minute in those with more than 100 beats per minute in 24-hour heart rate ECGs. This is the only significant effect on the heart rate decrease. There is no effect of the indication in ADHD, congenital heart disease, arrhythmias, short-stage obesity, or somatoform disorders. There's no impact of age, and there's no impact on effects on heart rate decrease during omega-3 fatty acid supplement. 25 years ago, I had the bitter experience of how a potentially life-saving therapy with propranolone in infants with severe heart failure was rejected across the board by the pediatric cardiologist. Today, this therapy is used with great success in India. This success has encouraged me to publish this video to motivate young colleagues to think outside the box. In my next video, I will demonstrate how to use this knowledge in patients with diseases of the autonomic nervous system like long COVID. Thank you very much.